Hello, my name is Thomas D'Angelo. I am a pharmacist and the owner of AmeriCare Compounding, located in Garden City, New York. AmeriCare Compounding is a compounding pharmacy specializing in compounded medications of all types, including sterile compounding. We also provide oral medications for erectile dysfunction and a variety of other disease states. Tonight we're going to be doing a instructional video on injecting Trimix, Bimix, and Quadmix, and it will be presented by Dr. Shervin Badkhshen from NYU Medical.
Thank you for the kind introduction, Tom. My name is Shervin Badkhshen. I'm a reconstructive urologist and men's health specialist with NYU Langone, Long Island. I see patients in our Garden City office as well as our Bethpage location. For tonight's session, I hope that it helps you become more comfortable with how to inject these medications, how to utilize them safely, and how to get off the bench and back in the game and spend more time with your loved ones. So let's get started. At this point, you've probably gotten a prescription for yourself of Bimix, Trimix, or Quadmix from your healthcare professional, and you've either had this mail order to your home via AmeriCare, or perhaps you picked it up in the actual pharmacy itself. Well, if you've picked it up through the mail order system, this is what you can expect to have delivered to your home in a discreet fashion. No obvious packaging, in a temperature-controlled package. Inside the package, you're going to find the actual kit with the important tools and medications, as well as some disposable ice packs. So unpacking the actual kit that we have, you will find some instructions that can go well with our video here today, as well as some insulin syringes here, and the medication itself. Finally, and certainly not the least, you have the alcohol swabs. So let's just say that it's 5 to 25 minutes before your anticipated activity or intimacy, and you want to get started. Well, reach your medication, make sure that it has been refrigerated. Common question we get is, how long can these meds go unrefrigerated, or perhaps in storage in an appropriate refrigerator? About 2 months is what you're looking at for the expiration dates, and about 48 hours in an unrefrigerated setting. Room temperature, thereabouts. So one other thing to make sure that you're aware of is that you have an amber vial here. This prevents the medication from essentially degrading or becoming less powerful or effective. Always make sure that you keep the inner vial with the medication in it inside of the amber vial. It is very important. Keep it in a safe location, and don't forget there is a little tab that I'm sure you've used before in other types of medications and products. So once you have that, go ahead and get yourself some alcohol swabs. 2 is more than enough. And you can grab yourself one of these insulin syringes here. Now, you may be very familiar with insulin syringes, but they come in all sorts of different shapes, types, colors, etc. The orange top here is going to actually have the needle. The white top down here will have the plunger. So you can safely take the plunger off, but hold the needle there on just another second. Take a look at the markings here. It goes from 10 to 100 units. You may be instructed to inject in different units or milliliters or other sort of units, but you want to make sure that you understand what you're injecting. So if somebody tells you to inject 20 units, you have to pull down to the 20 mark to inject there. So let's just say that we're getting started and you're going to intend to inject 20 units of what we have here for you, Trimix, for yourself. So before you get started, go ahead and open up your alcohol swabs. 2 will do, but open one at a time. And pop off the black tab. Most of these black tabs are disposable, don't need to put it back on. Every time you use this vial, go ahead and swipe it and wipe it with the alcohol swab. I usually just leave it there until you're ready to use it again. Now, you have to go ahead and take your insulin syringe and pull up beyond the area that you want to inject. So I want to put in 20 units. I'm going to pull out to 25 or 30 units and put some air and space into the actual vial to make it a little bit easier for you to actually withdraw. Don't try to, you may be tempted after you're done with the insulin syringe to put this back on. Don't do that. It's a very easy way to kind of poke yourself. Take the vial, flip it upside down after you've wiped it. Now go ahead and just show the tip of the vial with this silicone soft spongy area and literally plunge the needle in. It won't go anywhere. It should just suspend itself. Push all the way in, and now you put a little bit of air in there. Now you go ahead and withdraw down to where you want to be. So we're going to go ahead and take about 20, but I'm going to pull a little bit more, and you should as well. So pull out to 25 or 30, and then push to get the exact measurement that you're looking for. Okay? The difference of 5 to 10 units can make a big difference. So being precise and purposeful here is very important. At this point you can take it out, put the vial aside, and now your medication is ready to go. Put your injection to the side, make sure that the tip and the needle is in a safe location, stable, flat surface where you're not going to have a lot of rocking or back and forth movement. Now you can go ahead and just, for cleanliness, wipe the tip of the vial. Make sure again to put it back in the medication container, the amber container, and then seal it and refrigerate it. Make sure to have one of your alcohol swabs handy and you're ready to go. And now we're ready for injection. So let's go over some critical anatomy here before we start injecting. What you see in front of you is a model penis, looking at it from a top-down position, bird's eye view. I want to direct you to some of the positions that I'm going to call out. They're going to be like hour markers on a clock face. At the top over here, you're going to see the 12 o'clock position. The bottom, 6 o'clock. Depending on perspective, 3 and 9 o'clock. Now, really important structures you should be aware of. Up here at the 12 o'clock position, you have arteries, nerves, veins, and other really important structures you don't want to be injecting into. Similarly, at the 6 o'clock position, you're going to have the urethra, where your urine comes out of. You want to avoid injecting anything in this 6 o'clock position. Safe areas, or the safest areas, are going to be at the 10 and the 2 o'clock position. That's where you want to be injecting. And if you have to absolutely err on one side or the other, try to go to either the 3 or the 9, and don't go up or down. So you're ready to inject. How are you going to position yourself? I find that most of my guys are more comfortable injecting while they're sitting up with their butt positioned against a firm, stable structure. Could be a sofa, could be a bed. You could also sit down to inject, but that may be a little bit challenging. That is not necessarily the rule, so find what works for you. Once your trousers are down and your penis is in position, make sure you have all your tools that you need. That includes your alcohol swab and your injection that you've already drawn up beforehand. When you're ready to inject, go ahead and open up your alcohol swab. And for purposes of today, we're going to inject on the right side. Now, we should typically be alternating the sides of our injections and specific sites of our injections to avoid injury, curvature, and other problems that may happen over the course of repeat and long-term injections that you've spoken to your medical professional about. So we start by grabbing the head of the penis and gently pushing it forward and away from the body. If you're uncircumcised, unlike this model, please retract your foreskin and then specifically grasp the glands, the head of the penis, firmly but not so that it is painful, up and away from your body. With your other hand, this is going to be your injection hand, go ahead and just gently swab the landing zone for where your injection could be. It doesn't have to be precise. Sometimes you may even inject outside of this area. That's probably okay, but it's good to try your best to get it clean. Once it's ready, go ahead, pick up your injection and hold it like a dart. I primarily rely on my thumb and middle finger and position yourself ready for the injection here. Some men may require a hand on the penis or the body, or some other way to stabilize themselves. Do what works for you. When you're ready to inject, stabilize yourself and plunge the entire needle into the body of the penis itself. Again, at the 10 or 2 o'clock position, and make sure it's perpendicular. Make sure it is actually going to enter the entire place at a 90-degree angle. So on 3, we're going to go ahead and inject. 1, 2, and 3, and then we're going to push in the plunger all the way and pull out. We're going to hold some pressure. A few minutes is all you need. If you're on blood thinners, you may want to hold it for maybe up to 3 to 5 minutes, depending on the discussion with your primary urologist. And at this point, as you're holding pressure, it's really important to actually massage the medication into the penis so that you reduce the side effects of the throbbing and pain, and more importantly, actually get the good, efficacious use. Really let the medication work into the penis. What this does is spreads the medication into the corporeal bodies in different compartments of the penis. This is not like masturbation. Again, this is a massage. And after you've done that and held some pressure, again for a minute to 3 to 5 minutes, you can release and get ready for activity. When you're ready, and once you're cleaning up, you can go ahead and use your sharps container to actually dispose safely of your needle. This is available for purchase locally here at AmeriCare, and I'm sure at other pharmacies near you, where you could also deposit a full sharps container after it's been sealed to your local pharmacy. Thank you so much for tuning in, listening, paying attention, and allowing us to take care of you with your incredibly intimate and careful needs here. This is not easy to discuss. These are challenging, intimate issues, and we understand that. So again, thank you for your consideration and for letting us participate in your care. My name is Shervin Badkhshen. I'm a reconstructive urologist and men's health specialist. I'm the person who's been teaching you how to use these injectables today. Big thank you to our team here at AmeriCare Compounding Pharmacy. They are, again, truly best in class. They can take care of many, if not all of your needs in this space and answer many of your questions as well. And if you would like to speak to me personally further about these problems, you're more than welcome to. I see patients in Garden City and Bethpage as of now. Me and my team would be more than happy to take care of you. My entire practice is focused almost exclusively on reconstruction, mostly for men, and certainly erectile dysfunction within the men's health space. So more than happy to be of help however I can be. Looking forward to meeting you and hoping that you're having a great time with this moving forward. Be safe and have fun.